Hi everyone, this video will give you a brief overview of personality disorders. For some key background information, personality disorders are disorders or traits rather, that affect one's life, and specifically their ability to work, their relationships, and amongst others, the ability to function normally in a society. It is estimated that 1 in 20 people are affected by a personality disorder, and currently there are 10 recognized personality disorders. The personality disorders are typically broken down into 3 clusters: type A, B, and C, and this video will go over each section separately. With regards to type A personality disorders, for some brief overview, they typically present with delusions, can present with hallucinations, and odd behavior. And the main ones are the paranoid, the schizoid, and the schizotypal personality disorder. So the paranoid personality disorder typically presents with a suspicion of others. So the people are very reluctant to share secrets with those around them. They can be very secretive and very sensitive, and they have an extremely unforgiving perception and attitude whenever someone says something that they see as an insult on them as a person. There is a schizoid personality disorder, and this one is characterized by social isolation that is voluntary, so these people simply do not care about having relationships with others around them. They also lack interest in sex or any sort of sexual or romantic interaction. They also do not enjoy typical social activities such as going out with friends to the movies or for dinner, etc. And lastly, you have the schizotypal personality disorder. This one is characterized by thoughts that are odd and appearance that is a bit eccentric. So they might have a bit of a pressure of speech. They might be dressed inappropriately for the weather, so they might be wearing like shorts in winter and wear very bold colors that maybe do not necessarily go together, etc. And also they have the highest risk of developing schizophrenia, and this is key to remember, as out of all the personality disorders that we discussed today, this is the one that could most likely lead to schizophrenia. Type B personality disorders, they are often deemed the dramatic or emotional personality disorders, and there's 4 that I would like to discuss. The first one is the emotionally unstable personality disorder, also known as borderline personality disorder. And in this personality disorder, the patient is affected by something called splitting. So they either see things as extremely good and extremely bad, and people only fall into the extremely good or extremely bad categories to them. So someone is either the best doctor on the planet or the worst doctor they have ever seen. There is no middle ground for these people. They tend to be suicidal and, as the title says, emotionally unstable and vulnerable. And also they have unstable relationships as a result. They also suffer from impulsivity, and therefore this can lead to increased substance abuse or self-harm. The antisocial personality disorder is characterized by violence and manipulation. Those are the people that sometimes would be described as sociopaths by some. They tend to lack remorse, and they tend to act on impulse, meaning that they can be rather reckless when it comes to the safety, whether it's their own safety or the safety of others around them. They often lie frequently and tend to be quite cunning in order to make gains themselves. The histrionic personality disorder is the one that's called attention seeking. People who have the histrionic personality disorder are easily influenced. Think of people going to Love Island, those trying to be the center of attention, those who want to be Instagram famous, TikTok famous, whatever you call it. They will do anything and everything to make sure the eyes are on them and that they are the center of everyone's attention. And then lastly, you have the narcissistic personality disorder. They require frequent praise, they tend to be very arrogant, and they have an extremely inflated self-worth. They are very envious of people who are, according to them, doing better, and they have a sense of entitlement, and they need to be constantly reminded how amazing they are in order to be satisfied. Lastly, you have the type C personality disorders, and they are the anxious or fearful personality disorders. And the ones that I would like to talk about are the dependent personality disorder. So in this personality disorder, the patient simply lacks confidence. They really are fearing being abandoned, and they require a companion and someone who can make a decision for them because they themselves are incapable of making a decision. The avoidant personality disorder is someone who really wants to form relationships, so they're very different to the schizoid personality disorder, but they simply are way too anxious. They believe that those around them are thinking less of them, even if they have no proof of it, and they feel inadequate as a result. They therefore will withdraw, and if they ever receive criticism, even if it is objective criticism, they will take it significantly and badly, and it may result in them withdrawing even further from the social circle as a result. Lastly, you have the anancastic personality disorder. It is also called the obsessive-compulsive personality disorder, and in this personality disorder, the people are extremely inflexible. They're very dedicated to their work, and the work will erode into their spare time. And they're very meticulous about how they work, but they're also very particular. It has to be done their way, or otherwise it is not done properly, according to them. It is important to distinguish between obsessive-compulsive disorder and an obsessive-compulsive personality disorder, because in the personality disorder, the people do not think they have a problem. They think that everyone around them is simply not good enough or not trying hard enough. Whereas in obsessive-compulsive disorder, the person is aware that the intrusive thoughts that they have are not normal and they found them distressing. Whereas the obsessive-compulsive personality disorder is not distressed by their own work ethic and how much the work is impacting their life. They are much rather distressed by the fact that those around them don't seem to be taking whatever job they're doing as seriously as they are. In terms of the management, therapy is the typical first start, and you would often use dialectical behavioral therapy. And you can also manage any coexisting mental health conditions with relevant medication, as no medication is currently being used for personality disorders directly. This was a very brief overview of personality disorders. If you have any questions, feel free to leave them down in the comments. Other than that, thank you so much for watching.